I've contended for the better part of 2020. What is going on with COVID 19 is not about a public health matter, and it is not a pandemic insofar as it is a biological or health related matter that has escalated. I believe it was a manufactured and intentionally orchestrated biological attack. I believe this is biological warfare, and I believe it is being wielded with specifically political purposes. In the last 20 years, there is plenty of evidence that certain other nations have developed their national defense strategies in consideration of the potential implementation of policies connected to use of biological weapons. It's not as disclosed in the United States as it has been in other countries, and there has also been considerable contention around understandings of what would constitute a biological, chemical, or nuclear weapon that I believe is different for other countries than the United States acknowledges. And for instance, although I have no proof of this, my concern is that other countries would consider the sorts of things the United States does under the auspices of healthcare or medical treatment to actually be more appropriately considered as if it were a form of biological war or warfare. And that part of what is going on globally and has been going on for the last 10 years or more has been how the United States has calibrated its economic system in consideration of the reliance on healthcare and healthcare related costs and the relationship that support for our conceptualization of healthcare has when it comes to other components of the political economy. I mention this because if in fact we've been on this lockdown, well, presumably there has been some sort of contagious exposure that has been happening. Are there other parts of this country or even the world where similar things have been happening, where people have been working in situations where they have been intentionally exposed to something that is unsafe with the intention of creating some sort of time elapse mechanism so that if, as there has been anticipation, there is supposed to be a second wave that ends up getting initiated, that it would impact people that were intentionally exposed to environmental or other factors to exacerbate it, so that when it gets triggered later on, those people that could have provided one kind of service or one kind of response now will be debilitated, so they will not be available. Because if that's the case, then the question is, are there other things going on politically in order to try to give people some sort of leverage to claim those roles themselves, regardless of whether or not they have the qualifications? An example of this is that shortly after the state of emergency was declared in Texas, actually the day after it was declared in Texas, the governor of Texas got on the television and started talking about how he was going to call up certain kinds of students or certain kinds of retirees and fully empower them to perform in this crisis as if they had already completed their training or certification program. It wasn't that explicit. The way he said it was more political. But the implication was, if you have not finished doing what you needed to do in order to qualify for your license, this is an emergency and we need you on site and we're going to treat you like you did. That, to me, is a political decision that doesn't make as much sense from a public health standpoint, because in addition to having frontline providers of services, you also need to have administrators, and you also need to have people that are making sure that appropriate policies for prevention of a future exacerbation are put into place. And I have no evidence that people actually qualified to perform those roles are actually being identified and called up to participate. On the contrary, what's happening is other sectors that should have not been involved in anything that would be connected to a public health response are readjusting and recalibrating their product lines or their facilities to provide some sort of token economy or token economic contribution to the economic engineering that's going on, regardless of whether or not they meet what would be necessary standards in order to assure public health safety or to assure that other items connected to their networks cannot be disabused in the manufacture of a biological, chemical, or radiological weapon. There are plenty of instances of this being put into the public realm through public notices in the media and also in efforts, for instance, to discuss policy changes that needed to be made in important energy sector matters in the state of Texas. But then we're just arbitrarily and for political reasons decided to let the timelines lapse or to let the deadlines lapse, despite the fact that there was a very real need for a formal and official and legal policy reconsideration. So my concern is where right now, especially if there are domestic, if there's some sort of protest going on, especially if they have a major municipal bond issue now in the last month or are planning one for this upcoming month, and especially if they are trying to navigate political discussions about deployment of the National Guard and or the United States military. Where right now are people wearing bandanas and working with raw sewage? It's a very simple question on another matter. Where in this country did city administrators opportunistically exploit the situation to take people that are involved in infrastructure, very important and necessary infrastructure roles, expose them to a compounded level of risk during what is supposed to be acknowledged as a public health outbreak in order to opportunistically exploit them and put them in potential peril in a manner that could actually compromise national security even greater? It's a very simple question. Since there's been a lockdown, what governors and what city administrators allowed for deployment of personnel that were put into situations that increased the risk of exposure, either in the current moment or as some means by which to be exposed to a latent form of this for activation later? How many people that were involved in infrastructure or construction ended up getting sick and or dying because they were intentionally deployed to be exposed to things like raw sewage, while presumably the entire society and economy has been shut down because it's that severe? I think this is an absolutely urgent question, and I think that it is a national security and international security question. My understanding as part of the PPE was part of a political leveraging strategy by certain groups of people, including people in the medical sector and the biological health sector, but not exclusively. That there were labor demands connected to having protective equipment or other kinds of precautions implemented on behalf of the employer in order to prevent greater exposure of employees to health hazards. And that what is attempted for now with the emphasis on PPE is a form of leveraging for workers' safety. But it is not appropriate or acceptable to intentionally expose another group of workers to this kind of peril, including ones that have a specifically inordinate risk of certain kinds of environmental safety exposure hazards, in order to compensate another group of workers that is intending to wield greater leverage in this economic engineering. If there is a group of workers that intentionally agreed as part of some labor management strategy to launch and move forward on a biological weapon to compel some sort of concedence to their labor demands, and in the process refuse to expose and address the fact that an entire other group of workers that has a different role in society was being exposed to environmental harms that, by the way, would help them get paid more at the expense of meaningful infrastructure in the society and fixed asset base that could actually provide prosperity and stability, which decreases the demand for workers in the healthcare sector, then that needs to be addressed as it is. If they are using a biological weapon as a form of economic warfare, then that's the way this needs to be treated. And if they are trying to agitate or exploit long-standing issues connected to racial justice in order to reposition their operators within local administrations connected to public safety or law enforcement and or the actual city administration in order to effectuate this agenda, then that's how it needs to be addressed. That is what I mean when I say that we're not dealing with a civil participation. We're not dealing with a citizen's response or organizing. That is what I mean when I say this is organized crime.